Hello and welcome to Sterilization Standards Unpacked, navigating Canada's dental guidelines, where we'll talk about the evolution of dental sterilization, the people shaping it, and the standards guiding it forward. I'm your host, Sarah B. Cruz, and in every episode, we'll connect innovation to intention, because progress in dentistry doesn't just happen. It's built through consistency, clarity, and care. Here, we'll explore the practices that protect patients, the standards that impact process, and the professionals who set the tone for excellence. Whether you're in the operatory, the sterilization room, or leading a team, this space is for those who believe that quality isn't a checkbox, it's a mindset. Sterilization Standards Unpacked, navigating Canada's dental guidelines, is supported by Solventum, creating smarter, safer ways to deliver healthcare and advancing the future of dentistry through innovation and education. So let's get ready to get dirty and go dental. Hello, bonjour, and welcome to the final episode of Sterilization Standards Unpacked, presented by Solventum. I cannot believe we are already on the final episode of this podcast series. I think we could have gone easily 20, 25 more episodes of hanging out with me talking about dental sterilization. But, as someone in America where we are just starting our standardization and really diving into assisting this streamlined process of dental practices, I have learned so much with just hanging out with my Canadian friends and really watching the power of collaboration and consistency across an entire nation. As we've learned in these last few weeks, we've explored standards, the science, and honestly, the people behind sterilization. But today, we're looking forward at how the future of dental sterilization in Canada is being shaped by education, technology, and teamwork. Because you know what, folks? Future is not a mystery. It's a maintenance schedule. And as we always say, innovation is progress made practical. And practical progress doesn't come from a box. It's built one verification cycle at a time. And with someone who has an aunt as a dental hygienist, and I was able to teach her a few things just getting my sterile processing certification, or should I say medical device reprocessing certification. If I can teach her a few things, imagine the impact that Canada can have on patient care all throughout this nation and trickle into, our standards. I'm very excited. So as we start to talk about the future, I have a very special guest with us. We have Leeanne Ismail, clinical specialist for sterilization at Solventum, and she covers from the acute to the dental, from start to finish. She's with you to the end. And during this time, she's really helping with that next wave of progress and making sure it's less about rewriting standards and more about embedding them in software, in education, and in the daily practices that we may actually see as patients in these dental spaces. So without further ado, Leeanne, everyone.
Sarah, thank you so much. Hi, everyone. It's a pleasure to be here. Thank you. Super excited.
Mm-hmm. Now, Leeanne, you hung out with us before on the Beyond Clean Canada podcast, yeah?
I did. Yes, it was a great time. We had some good discussions on sterilization in the acute space as well and kind of where things were heading in that space. So it's nice to be able to do this on the dental side today.
Yeah, and I feel so flattered to be involved in it, truly. And I remember listening to the episode and you were talking about that. And the biggest takeaway I got from that is that improvement comes with integration, not reinvention. And even though we're talking about dental, it's all sterilization. And I said at the beginning of this podcast series that I think we should start recognizing our sterilizers just a little bit more every day because of just truly what an amazing piece of equipment that they are and the amount of work that goes behind, making sure they work. You know what I mean?
Absolutely. You're right. And a lot of the times I think we take that stuff for granted. We don't really realize the amount of work that goes on behind the scenes and everything that goes on in reprocessing.
Mm-hmm. Yeah. And So one question I initially have that's kind of been ruminating in my head as we've interviewed our other guests is, in your opinion, do you think the massive scaling that's been, I guess that's pun intended, the massive scaling that's happening throughout Canada is because of the CSA's Z314 2023 updates? Or do you think it had enough momentum in 2018?
That's a great question, Sarah. I think that edition specifically, the CSA Standards Z314, it made a big impact because they included actually a really important detail finally in that updated revision in 2023. So they had actually included some new information on how to make PCDs or process challenge devices in-house for tabletop sterilizers. So in dental, this was pretty significant because, as we know, most dental offices use tabletop sterilizers, and we really never had set guidance on how to properly make one for these tabletop sterilizers. So I think having that included in the new standards, it definitely trickled into some of these other provinces and education-wise. So we've definitely seen it have an impact throughout provinces actually here.
And can we just take a second, listeners, let's just take a second there. Making packs for tabletop sterilizers. I remember learning about how to make packs for the big boy sterilizers, with the St. Joseph's Cross and everything and the number towels and everything like that.
Yes.
And that I learned how to do that, but I can honestly say I've never done that before in my sterile processing career. I've fortunately never had to do that. But the fact that it's 2025 and this is the big innovation, the big movement, I think we should all really appreciate just how far medical device reprocessing had to come in order to help different professions like dental.
Absolutely, Sarah. I couldn't agree more. We've definitely come a long way, and obviously there's still work to be done, but we're moving in the right direction.
Yeah, and I think that's a really great segue for the whole topic of this episode. Technology is reshaping how we verify and validate and and I think that's a really great way. And I think that's a really great segue for the whole topic of this podcast episode is that technology is reshaping how we verify and validate. Rapid read BIs, integrated data logging, and digital traceability are moving from hospitals to dental practices. Things that are happening in medical device reprocessing as second nature are now this new age wave, dare I say. So imagine seeing your sterilizer's history like a patient chart, clean, clear, and complete. Every cycle of progress starts with that clarity. And that's where we're moving to, is that future. So, Leeanne, if you had to tell me what you would like to see in the next 10 years in dental, what would you tell me?
Oh, that is a great question, Sarah. I think, as you mentioned, traceability is super important, and having some sort of tracking system be involved, I think, is going to be the new wave of the future. We've done that pretty well in a hospital and acute settings so far, but I think, honestly, moving into dental, seeing a little bit more of that technology being involved in what they do on a daily basis would be tremendous. We do still see a lot of the original paper log books in dental, but the issue we have with these is, sometimes it's hard to read writing. Sometimes papers fall out of these log books. Things go missing. So I think that's why a lot of standards are also pushing towards some sort of electronic copies, digital tracking systems for these reasons specifically, just to have everything, as you mentioned, stored on one nice file on a PC. You can easily retrieve it. And it's also there as a secondary or a backup. Hopefully that's something that we can continue to work towards in the dental world.
Yeah, and I couldn't agree more. I remember reading from the Health Canada devices page about the Health Canada MDR 2020, and they support data integrity and traceability for electronic records in their sterilization monitoring. So you had the 2018 CSA Z314, and then in 2020, Health Canada went even further to say, no, we have to get this in there. And then 2023 said, yep, absolutely. Let's put this right where we need it to be inside of the standard document. So the progression is there.
It is there. And I think eventually and hopefully, I think that will be at some point, who knows, it might even be something that's mandatory moving forward to have these electronic copies. That could be the new wave of the future, but it'll be pretty interesting to see where it goes.
Oh, I like that. I like when we throw mandatory or regulatory around. I like that. I like those firm have to, must words.
That's right.
Should, could, ought to's. I'd rather have a must. You know what I mean? So,
absolutely.
All right, Leeanne and listeners, we're going to take a quick break for a word from our sponsor and, of course, our last practice defined term session. We'll be right back. It's time for Practice Defined, a quick pause to unpack a key term shaping dental sterilization and safety. Let's talk preventative maintenance intervals. A preventative maintenance interval, or PMI, is the scheduled inspection and servicing of sterilizers and washer disinfectors based on manufacturer instructions and the expectations outlined in CSA Z314. Regular PMIs help detect wear, calibrate instruments, and document ongoing equipment validation. In Canada dental practice, PMIs support quality audits and demonstrate a continuous commitment to safe reprocessing. That's Practice Defined. Now that we're one term closer to excellence, let's jump back in today's episode. Hi, everybody, and thanks for joining us after that short break. And I still can't believe we're on this last episode, but we are very fortunate to have Leeanne Ismail with us. And she is the clinical specialist for sterilization with Solventum. Now, before the break, Leeanne and I were discussing what she would like to see in the next 10 years for the dental sterilization world. And I am loving this conversation because she's already talking 10 years into the future. And in America, we're at day one, and I'm thrilled. So this is great. I just love thinking about the future and progress and moving forward and challenging the way we've always done things. So I think this is my favorite episode so far, Leeanne, I got to tell you. So.
Oh, well, thank you, Sarah. I find this stuff super exciting too.
Yes. Listen, we're just a bunch of MDR nerds. Okay. We're just hanging out, getting a little nerdy, talking about sterilization, whether it's a tabletop. I had a tabletop. We called her Big Bertha. If you didn't vent her fast enough, she got really angry, but
love it.
Yeah, so I digress. So let's get really into this now. When we talk about updating standards or processes, besides the fact that things are different from different provinces throughout the nation, and in America, it's state to state, when you start to look at all those subsections of how we're going to apply, what we're going to do, it really makes you wonder how everyone can get on that same page. So in your opinion, how do you think manufacturers and clinicians can partner for progress? We've already partnered this far to get us here, but what do you think needs to get done further?
That's a great question, Sarah. And what ultimately I would love to see for both sides is to create compatibility through obviously the tools that we need for sterilization, but also the standards and guidelines. Make those compatible in order for us to move forward in the way that basically CSA standards cover the acute care center. So you hit the nail on the head when you mentioned that here, each province, their guidelines do differ ever so slightly in terms of how often, for example, a BI PCD or a BI test pack should be run. There are some provinces that still require it only monthly, believe it or not. So I would love ideally to see moving forward all these provinces to adopt the same expectations and standards that we have in the acute care center, right? Ultimately, sterilization should be the same across the board. Raise the bar so we're all on that same page. But that would be the ideal case. And recently we have had provinces actually moving towards changing their provincial guidelines to actually meet CSA standards exactly. So it's been super exciting to watch over the last couple months. Most recently, actually, we had Manitoba jump on board. We've had Alberta make some changes. Quebec was another big one. So we're all starting to see these provinces move forward in that direction. We're lacking a couple more, but I'm hoping the future is bright for all our provinces and we will move to one specific standard across the board.
I mean, I would hardly say that's a stretch goal. I think that's just going the extra kilometer, right? So really pushing for that. And if you all can recall our previous episode with our guest from Montreal, where he discussed the facility actually aligning more with the CSA standards and pushing past their provincial goals and expectations, it is possible. And there are people and professionals and entire clinics that are that, well, I guess you can call that tenacious. Huh, Leeanne?
Absolutely. And vigilant to want to obviously provide better care for the patients themselves, right? And hopefully from the manufacturer's end, let's simplify tools and solutions to make reaching these goals, standards, and guidelines possible.
Right. And I think it really harmonizes that ongoing alignment between all the provincial colleges, right? They talk about that in the ODQ. I won't try to say it because it's in French and I will not be rude. But, and you see that in 2023 to 2024 where they're pushing for that. They're encouraging the harmonization of policy language. They want to achieve nationwide standardization in dental sterilization practices. And I think that's ambitious because, we can't even all call ourselves the same name, central sterile processing, MDR, so, I love a good challenge like that.
That's right. And obviously, like you said, there are different, slightly different limitations, especially space, usually for sterilization being a major factor for dental. But ultimately, I think we all have that same goal in mind. It's making sure that devices are properly sterilized to use on patients, regardless of what field we're in.
Definitely. It's all about how collaboration is driving that innovation and that unity. So thinking of that implementation, and you said space. So, let's lean into that. How do you think smaller clinics can adopt this digital verification, some of these alignment opportunities in the verification process and really afford themselves that higher quality of patient care?
Right. And that's a great question. And honestly, I think that comes down to the manufacturer and what the manufacturer can provide for the customer. So I can speak on behalf, of course, of ourselves here at Solventum. So, for example, we have auto readers. Our 490 mini auto reader, for example, it has a really small footprint, literally about the size of the palm of your hand. Doesn't take up a lot of space wise in a small device reprocessing area, but it also comes with an app, right? An online electronic app that they can use. So as long as they just are able to download this app, it essentially replaces a paper logbook. So it's things like that clinics can do. And again, most of these apps are usually free of charge to kind of help elevate their practices. Again, as we mentioned, going electronically to even be more environmentally friendly, to have a better maintaining of patient files, of sterilization files. So little things like that, I think, can make a really big difference in what, as manufacturers as well, we're able to provide for the end user or the customer.
Right. So it's really embracing that idea that change isn't top down anymore. It's built sideways from, And, when you think about top down, it's not even that hierarchical like director, boss. You know what I mean? It's patient is at the top of that hierarchy. And then everything else is quite literally right in line with each other. The manufacturer, the department, the technician, the dental provider, the services. And I think the sooner that we embrace that, which frankly is being pushed in those 2023 updates, the better it will be and the quicker the outcome will be.
I agree. I think, as you mentioned, Sarah, we all kind of have our role to play in device reprocessing as manufacturers, as educators, technicians, and whatnot. So I think we all can bring to the table a little bit here and there to really just continue to drive patient safety and these guidelines and standards forward.
Yeah, definitely. I couldn't agree more. And you said one of my favorite words, education.
Yes.
So what you knew it was coming. You said I lit up and I was like, oh, that's wonderful. So as far as education, what do you think we need in the next 10 years to help us reach these ideas that you just shared with us?
So this is something that is so important, I think, to bring up. A lot of the times in the acute space, we do have an MDRD course. Sometimes it's a requirement. Sometimes, it's a refresher, whatever it may be. But that education for an actual medical device reprocessing course is available in the acute space. What we find, unfortunately, in the dental space is you've got a dental hygienist that's actually doing the dental hygienist work, but has also just taken on the role of sterilization somehow. So, I'm sure they've done in-house training or whatnot, but I believe if they have like some sort of formal course for dental specifically as well, to include a lot of this information that even CSA provides now, like how to make a proper in-house PCD for tabletops and things like that of that nature, I think is super important. That education is crucial in order to make sure that these clinics know exactly what they're doing. Because unfortunately, we've all been in some places where they don't. They really don't. So that's why even education from us, from our standpoint, what we're able to go in and also provide is essential as well.
Yeah, definitely. And I will be the first and not the last to say this because I definitely got taught the way that somebody else did it because they were there the longest. And, when the site surveyor says, why do you do it like that? It's, well, Pam taught me that way.
That's right. That's what I was taught. Exactly.
Right. And I really appreciate that there's this push to not just say, well, Pam taught me this way and say, because Pam went and looked at this and we reviewed these steps. That's exciting.
Right. Absolutely. Even things like that would be a step forward in terms of education. I agree.
Mm-hmm. Yeah, and let's pay respects where it's already happening. Like, this is a big shout out to, well, I guess you can say the behind the scenes silent warrior, the medical device reprocessing technician, right? Yes. So they are in this space. They know these standards. They know these expectations. They're seeing the alignment, right? Or maybe you're in that space and you don't know. How can you suggest that they even start looking for this? Like, you don't just wake up one day and you're like, I'm going to check out the CSA standards. How would you even help them get that into their facility?
Exactly. And I think that's a role that we can play if we are able to, whether it's, through clinical specialists like myself or the amazing reps that we've got, their feet on the ground that are able to go in there and check with these clinics, gauge their comfort level, see, what they're doing. Are they aware of certain things? It's amazing sometimes what you can learn, Sarah, just through a walkthrough at these facilities. When I've been able to go into a couple of these dental spaces, I love to be able to just go in. I ask them questions. Oh, are you guys aware that there's new guidelines out there as to, for example, how to make your PCDs? Are you guys running a control? Do you know what you're supposed to be doing in terms of, reprocessing in general? So I think ultimately it's it's really important for us to be able to provide some education, but maybe again, have designated roles in the dental space that are just specified for device reprocessing as well. I know they wear a lot of hats in these dental clinics. So that's something maybe to address in the future as well.
You couldn't be more right, Leeanne, because the courageousness of a curious question is that profound. And a lot of the time it's just because we don't know what question to ask. And I can really appreciate the wearing all the different bouffants in a place. I often make that joke, I wear a lot of different bouffants, but like in a medical facility, but like in a dental facility, you're quite literally wearing, well, I guess all the bouffants at once, right? So
literally exactly that. It's really different. As I said, we don't necessarily always have a designated person for device reprocessing. And they do. They've got many, many different hats or bouffants, as you said, to worry about. So it's something to very well consider down the line. Can you have somebody specifically for reprocessing? Will it be mandatory, maybe in a hygienist course, to actually have a larger section on the knowledge of sterilization for all hygienists across the board? So interesting stuff to see what happens moving forward.
Oh my gosh. You know what this is kind of like? Like, talk about history repeating itself. How much you want to bet before podcasts were obviously a thing because they didn't even have the internet at this time. Someone said, hear me out. What if we centralized sterile processing or medical device reprocessing? Oh, wait, that did happen. Someone did say that, and now we have an entire profession built on it, right? So
right. You never know. Exactly. We try, like you do with these amazing podcasts, to reach people and, put our ideas out there and thoughts out there. But like you said, you just never know what happens in the future from one thought, one idea.
Mm-hmm. Well, I think it's safe to say that, this episode, let alone the podcast series, is going to be a really big part of that. And, as we come to a close on our season 1 of the Sterilization Standards Unpacked, I just want to really encourage everyone to remember this, that progress isn't perfection. It's participation, right?
Love that. You hit the nail on the head, Sarah.
Every clinic that documents better, trains deeper, or asks one more question is moving the profession forward. This is history not repeating itself, but rebirthing itself into a brand new space. To Leanne's point, happen in our acute care space, and it's only time that it's up for dental. Yeah?
We're getting there. I can feel it.
Definitely. Well, Leeanne, I couldn't think of a better guest to bring us to a close this season. I want to thank you so much for coming on and really shining the light, being the light at the end of the tunnel, because we're just in it, and let's see where it's going to go.
It's been an absolute pleasure, Sarah. And like I said, you know what? Hopefully these thoughts and our ideas will make a difference out there. But I'm excited to have been here and been able to have some of these frank discussions with you. Thank you so much.
Yes, my pleasure. And as your host, Sarah B. Cruz, I want to thank you all again for joining us for Sterilization Standards Unpacked. Remember to keep fighting dirty and solving with momentum. Take care. Thanks for listening to Sterilization Standards Unpacked, Navigating Canada's Dental Guidelines, where we connect innovation to intention and recognize the progress driving dentistry forward. Every conversation here is a reminder that progress doesn't just live in policies and products. It lives in people, the professional choices we make, the standards we uphold, and the care we deliver every day. If today's discussion inspired and motivated you, share it with your team and keep the conversation going. Sterilization Standards Unpacked, Navigating Canada's Dental Guidelines, is supported by Solventum, creating smarter, safer ways to deliver healthcare and advancing the future of dentistry through innovation and education. I'm Sarah B. Cruz. Thanks for joining me, and until next time, keep fighting dirty and solving with momentum.